Ed, you interview a lot of retirees about various issues, and I want to zero in this segment on the health issue. How often do retirees report that health issues have upset their plans, be they financial or in terms of lifestyle?
We start with 90% of seniors have chronic condition, at least one chronic condition according to StatCan, so they have to learn to adjust to it. Some of the things they'll have to do is adjust in terms of changing their accommodation, perhaps to something on one floor. They'll have to find transportation if they need care for that condition, which might not be bad if you live along the subway in Toronto, but if you live in rural Haldimand County, it could be a bit more challenging where there's no service to take you anywhere. They also have to adjust in terms of activities they can't do by buying support services. So it comes in the form of everyday expenses, and while OHIP covers quite a bit, there are some things it doesn't cover.
Okay, so what you said suggests to me that in your financial planning for retirement, you've got to consider some sort of access to money to cover health issues. Even though we have public health care here, you will be bearing some of the costs, most likely based on those StatScan figures.
You will be bearing some of the cost, and depending on your condition and whether it's one of the better covered ones, those costs could be substantial. In some cases, if you had a cancer, for example, that's of a kind that's not well covered, they could be quite costly. But even so, just issues like transportation add up.
Okay. Thank you very much, Ed.
You're welcome.